Testing the microphone, testing. Testing the microphone, testing.
Good evening, everyone. Today is January 10th, 2023, and this is a committee of the whole meeting. And one of the councillors thought it would be a good time to explain what a committee of the whole meeting is. So I have just a little bit of information. Committee of the whole meeting provides the opportunity for council to hold discussions on matters, determine a process to proceed on issues, and receive information from administration, delegations, or subject matters. Committee of the whole meetings are for research and information sessions that are held in less formal atmosphere than a regular council meeting. We can't make any formal decisions, and it will be passed up to the next regular council meeting if we need to make any decisions on things. So with that out of the way, I would like to call the meeting to order and go to 2.1, adoption of the agenda. Is there any changes or corrections for the agenda for January 10th? Seeing none, I'll ask for a motion to adopt the agenda. Councillor Auld.
I'll make that motion to adopt the agenda for January 10th, 2023.
Thank you very much. All in favor of that motion? And that's carried. So this evening, I'm very pleased to have Compassionate Care Hospice Society with Jessica Bosman and Stephen Taylor here with us this evening. And I just remind you to push the middle button till it turns red, and then you're live. And thank you so much for coming. I really appreciate it.
And thank you for having us.
You can go ahead.
I can go ahead?
Yeah,
Okay,
she's
thank
just checking the door.
Okay, first of all, we'd like to thank the council for inviting us back to speak. After our last meeting, we felt we weren't asked the hard questions, but after reviewing the town budget video, we hope we can surprise more answers to some more recurring questions that came up. We're hoping that this can lead to shedding some light on our proposal funding ask and spark some good further discussion. We will not be repeating our last presentation unless you request specifics. However, one update we wish to share with council is that since some of the stats have changed since our last September meeting when we first wrote the proposal. There was, it's in the last. Now there is only, hang on a sec, since September, 6 more community members have died while being on a wait list for a hospice room. So that's 6 families. This now only makes our total wait-listed deaths to 19 individuals and families. This also now makes a total of impacted local families who have been affected by a wait list. With that said, we will now proceed to answer some of the questions brought forth during the budget video. Please feel free to interject any time you wish. Is hospice care the municipality's responsibility? There never has been full, solidified, sustainable operational funding available through AHS, the Alberta government, or the Canadian federal government specifically for hospice operations. There is no specific funding source, therefore there isn't any downloading from provincial or federal health services specifically for hospice operations. Because there's nothing to download from, well, there is nothing to download because they haven't given anything to us. Yes, AHS does subsidise the room, and if you'd like to ask those questions later how they subsidise it, fine. So that we can get to that point, and that applies to all hospices. There is no secure, continual operational funding set in place for hospice operations. Jessica.
Question 2, what other funding avenues has CCHS applied for? Well, we have brought along a list of both provincial and federal grants that are available for both social or health services that CCHS has attempted to access. This list does not include the grants that we applied for specifically for programming. The only operational grant that CCHS has been approved for was that of the Alberta CIP Operating Matching Grant. With this grant, our society has to provide half of the funds that are asked. as well as can only be applied once every 3 years. It's also capped at a certain amount, meaning it's not sustainable flow of funding for each year. CCHS can reapply for the match CIP funding again in the year 2025. And also, just as a quick example to the availabilities for federal grant initiatives, for example, the Canada Health Grants had 42 different grants available over the last year. Out of the 42 grants available, none were designated towards hospice operations. There were lots of funding grants for addictions, mental health, PTSD, prevention of chronic disease, health research, just to name a few, but we did not follow any of those umbrellas. Another big grant that I'd like to also mention is that big Alberta government grant for palliative end-of-life care that came available last winter. That was a really big one. CCHS did apply for it, but we were declined for funding. For one, funding through this grant was not eligible for operational costs, which is what we're here for today. So instead, we did apply for a project-based palliative end-of-life care initiatives instead. However, we were still denied the provincial funding. Another source of Alberta palliative funding is that of the rural in-home funding, and we spoke a little bit about that last time. But again, we cannot utilize that funding because it is only designated towards family who are caring for their loved ones who are dying at their home. And I have a list here for if anyone wants to take a look as well.
Is that Steve? Okay. Regards to strategic planning, in which we thought that was a rather good point to bring up. CCS has been following strategic planning in stages since our very first organisational meeting. We had a specific strategic planning meeting after that meeting. And our first goal was to have a hospice room. And then 2 years later, just before COVID, we knew things were moving along, so our strategic plan was to hire an executive director because it was getting too much for one volunteer, and the future planning for a second room. Then COVID happened, and we all know what happened there. Although we were still successful in hiring Jessica in 2020, and also maintaining high central hospice occupancy rates, we had to postpone expansion of a second room, but held again off due to a lack of sustainable operational funding. By the end of the pandemic, it had become alarmingly evident, based on our occupancy rates and waitlisted numbers, and the AHS capacity allowance from the Alberta Palliative Frame Addendum, that CCS needed to continue on following through with expansion. Our next strategic planning session is to be held in March, this coming March, and we're being facilitated by an AHS facilitator. So we'll be right on track in line with what they're saying and what we want. So we have to work. This is where another concept of working together with them instead of just us, hospice being on their own doing it. We will focus on our 2 hospice rooms being totally utilised to the maximum capacity and offloading pressure to rural home palliative care through creating our own 24-hour in-home hospice care team. So we're already planning ahead for the next stage past the 2 rooms. We just don't come up here and say, this is what we're going to do now. We're planning ahead. And if the way the numbers keep going, a year down the road will be too late. Or 2 years down the road will be too late for it. Now, all these numbers you can actually, if you want to, verify them with Pat at the home care office. So these numbers all come from home care because they are the responsible party. But we are planning one step ahead at a time. We only plan one step, and we make sure that step works before we carry on to the next step. We have no room for failure. No room for failure. This is too big. Hey.
So the federal government is encouraging an aging in place initiative and has for a number of years. This means supporting a person's desire to age within any setting of their choice, and this is wherever they consider to be their home. Whether that's, maybe in assisted living facilities or at-home settings. The idea is to age within the community with social or health support services to remain in a setting of choice for as long as possible. Hospice in our community is working with the aging in place, not against it. Our mission states to provide hospice care within the community in a home or home-like setting to all individuals and their loved ones, meaning that our goal is to help people maintain or stay within their community and choose to where they want to live out their remaining days and not be transferred out of community to die, which often happens with waitlisted individuals. There are people who wish to die at home, and CCHS fully supports that. A lot of times, the management of care, limited home care nursing staff, pain management, medication requirements, or the physical, emotional toll is too heavy or great to be able to maintain that quality of life during the at-home deaths. Sometimes people have no choice but to be moved into hospital or facility to die. That is why having a 24-hour professional hospice space will always be needed and required to offload pressure to acute hospital beds. The other side of that is there is a huge volume of people who do not wish to die at home. CCHS also supports that. Some people may feel like they are a burden to their family during their end-of-life stages, or some people just feel more comfortable with the 24-hour round-the-clock nursing care provided within the hospice. This is why hospice care will never not be utilized or needed within the future. Steve.
Oh, thank you. We haven't reversed this, by the way. We just. Now we'd like to remind the council how far our society has come in a short matter of time. CCHS has been asked by Alberta Hospice Palliative Care Association, which is the major hospice association in the province, to mentor 2 other Alberta hospice societies during their start-up phases. CCHS has also been interviewed by the Alberta Hospice Palliative Care Association, highlighting our hospice successes. CCHS has been told from AHS Central Zone managers that our occupancy rates are among the highest in central Alberta and that our hospice layout is a hidden gem. Also, one of our CCHS directors holds one of 2 provincial hospice seats within the Alberta Palliative Care Public Awareness Project Advisory Committee. Talk to you about them in a minute. Long story short, the Compassionate Care Hospice Society, often refers to as always as Rocky's Hospice, of course, has put Rocky Mount House on the map in terms of the Alberta palliative world. We are not. For anybody in the Hospice Society and us and what they think of Rocky, then you'll get an answer, and it won't be negative. Yeah, you know, we've come a long way. Okay, the golden question is hospice a social service or a health service? Answer to that is either both and neither. We are a community service, strictly for our community within Clearwater County and the town. And our catchment area is the town and Clearwater County. And that we work directly with home care in conjunction with Good Sam and AHS, of course. Death was around a long time before social programs or even before healthcare was even thought of. However, hospice core operational funding does not have its own continual sustainable funding stream within provincial or federal healthcare or social service programs. Death will never go away. I don't know anybody who's not going to get out of this world alive. Sorry, we're all going to die. The funding that we'll be asking for the town is to cover annual core operating hospice costs. All other costs, hospice will still be covering through fundraising, donations, and grant applications. Things like community programs, training, bereavement support. We have a bereavement program going in January. I'm presently mentoring people at home during bereavement. Death education and hospice suite medical inventory, and all the furnishings that would all continue to be covered by us, which comes through the, raising money in the town. And unlike Red Deer Hospice that has a huge base of businesses to go pull from, we aren't in that position. And our position is it's a community service. We can argue till the cows come over whether it's healthcare or whatever. It's taxpayers here if they want the support. Every time we've asked people about hospice, they either say 100% behind it or what is hospice, we don't have a clue. And our biggest question has always been, how do we educate people in a time when people don't want to talk about death? Nobody wants to talk about death until it actually happens to them. So that's a pretty, not a nice note to end things on. But if you ever come to one of our directors' meetings, we don't sit around being glum. We actually have a few jokes once in a while. But we also are pretty serious about what we're doing. Any questions? I'd like the hard ones, please. Dale, you're looking very serious. I know you could come up with a couple. I know you, and I've said, I bet you Dale's got some good questions to ask tonight.
Thanks, Steve. So the first question I have is, I don't understand how the organization operates. So if you can just give me a thumbs nail sketch of how the organization operates. You've indicated there's a couple of people who sit on provincial boards, or somebody who
Yes,
sits
okay.
on a provincial board. You know, how often do you meet? How big is your organization? Just a bit of the workings.
We are set up as a non-profit, and we have, let me think, we have, Jessica is our executive director, and we have a part-time fundraiser, Melissa Drake, who we require to do that, and we have approximately how many members?
We have about 25 members, but it's fluid because oftentimes a lot of our volunteers aren't membership volunteers. They're just people from the community that want to help.
And then we have people
certain programs.
who go down the States every winter. But we have a hardcore of probably 14 women who are absolutely hardcore volunteers. Now, everybody is trained, bereavement. We have proper training for, AHS training. We have to be cleared by Good Sam and Alberta Health Services. We have to be, the room has to be inspected and approved by Alberta Health. We have to come up with all these standards. And
In terms of the structure of the tri-partnership that we hold, so there's Alberta Health Services Home Care, there's the Compassionate Care Hospice Society, and then there's the Good Sam Society. So together we work together in getting families into the suite. So Alberta Health Services, they handle the admission and the criteria needed for admission into our hospice suite. And they remain the case manager for that client. The Good Sam, their part of the deal is they supply the location and the 24-hour nursing staff, cafeteria for meals, etc. And then the Compassionate Care Hospice Society covers the fees remitted needed to run the suite. So monthly fees include like the rent, the food, professional care, parking spot, that sort of thing, as well as we provide the bereavement programs and inventory, supplies, restocking, that sort of thing. In terms of the structure for what we have for our hospice suite specifically, outside of that, or organization, again, we provide free bereavement, we provide educational resources for the community, we act as a contact base, and growing that way.
we also have new programs online, which will need a few more volunteers, which will be summer-based. We do quite a few things actually. We don't just sit around worrying about one or the two rooms. We're always planning ahead and always getting people involved. We're progressive. Any other questions, Dale? I mean, I know. Did I answer your question?
Yes. Other than who's on your board that sits on the provincial?
Oh, okay. No, okay. Have a guess, Gillian. Actually, I should give her blow a trumpet here. Her passion is for the last 12 or 14 years, starting in Red Deer, has been palliative care in her home, and she's a home care nurse now. And if I don't smarten up, she can put me away into a home along with her mother. So I have to be very careful.
I wanted to ask a question about the equipment that's in the room, because I know that Jessica and I have talked before. So along with this funding, everything that's inside of the room is supplied by
Us.
the compassionate care. It's empty room. It's just a space in the Good Sam's, and then you have to. Can you go over the list
Okay.
of things? Because I know you're always either applying for grants or you're fundraising specifically for, like the towel here.
The towel warmer is $5,000. The town did pay half of the funding for a chair, which was, how much is that, everything seems to come around $5,000 or $6,000 no matter what we do. And remember, everything in that room has to be medical standard. Everything has to come through Good Sam to their standards. We just can't go out and buy stuff from the brick. No, that's not happening. A lift. The last lift we got was just so people can stand up in bed. This is $5,000, $6,000?
$7,000.
$7,000 just for the lift.
Yeah.
So that's the kind of things we fundraise for, and they are needed. If we have a patient in the room that needs that lift, we will get the lift. We don't Mickey Mouse people around and say, look, you don't know you would have somebody around about, pretty big person who needs lifting all the time. The nurses there can't lift, so they have to have the proper equipment to do it. So we will get the proper equipment. The beds. We have how many mattresses now? Because they change because people need different mattresses. Yes.
In a nutshell, rounded to an even number, it was about $50,000 to initially furnish the existing hospice suite. So that's including fireproof garbage cans, that's including lifts, slings, sheets, everything. Since opening, we have probably added close to $10,000 worth of additional equipment, not supplies. After every discharge, there's usually between, I'd say $40 to $100 worth of funds that we put back into the suite, which does include welcoming flowers for the next family, welcome basket, and just supplies that needs to be restocked. We project probably about between $60,000 to $65,000 to do another suite full, just keeping in mind, of course, inflation costs and, the warmer blanket that we didn't have initially that we added after, so we're going to add that to our next budget to ensure that everything's included.
At the moment, where does the room sit at the moment? The first level of management in Red Deer has approved it. Good Sam, their head office has approved it. It's even gone to their directors. They've approved it. But yes, second room. The second room has already been allocated to us, and they're on board. Remember, people have to pay to go into Good Sam, and we do not charge anything. I was asked this question at the county, why don't you charge? And quite frankly, morally, I can't see charging people to go somewhere to die. That's not in nobody's mind that we have to pay.
Thank you. I'll go to Councillor Hutchinson and then back to Councillor Shippold.
I have a few things, but just touching on your last comment, from what I've researched, most healthcare plans will cover compassionate care fees. Is that not? So if we didn't have your facility and it was being utilized out of the hospital for end of life, that's covered by your Alberta Healthcare, or if you have Blue Cross or insurance, is it not?
Not everybody has health insurance. I have old age insurance, but that doesn't cover my hospice care.
But if you were admitted into the hospital, that care would be free, would it not?
It would be provided in the hospital, yes.
Yes.
But as we'll go back to what Jessica was saying, was aging in place.
Yes.
In the last while, if we hadn't had the hospital bed or the hospice bed, how many people would be in the active beds at the hospital?
Right, I don't disagree with you at all, I just kind of was looking at clarity on that.
But as far as the people with insurance, yes, families do come and donate money. But some families come in, don't have the money to donate to us. They don't have that ability. And we don't say, well, sorry, you can only come into hospice if you can afford to pay. No, that's completely out of it. People come in on a need basis from the community home care. They decide who comes, and the families have to decide they want to send people there too. It's not our decision who goes to the hospice.
I guess where I'm kind of going with that is the government recognizes it if you go to the hospital. And I know I dealt with that with my own mother, who was, because there was no place else to go, and went into the hospital, and her bill is taken care of. So the government recognizes that care in that facility, but yet they're not recognizing it in the private. And that, this is where I'm, I mean, I totally appreciate everything that you guys do in the facility. I'm stuck on the government part of it.
The Good Sam is not private. It's a non-profit contractor to the Alberta Health Services. They contract Alberta Health Services to supply their service.
Right, but I'm saying if the facility wasn't there and you were being admitted into the hospital, the government is recognizing the care and giving you the care. So on doing some research, there was the 2014 provincial framework that their initiative is they state in there that they want to develop a detailed hospice capacity plan back in 2014. And then this past year, December 2022, the government gave $2.5 million to the Edmonton Pilgrims Hospice Society as part of the 8-month engagement project on palliative and end-of-life care. And from what I understood reading those articles, the province is looking at low financial feasibility residential hospice models, potentially opening up future streams of government funding. So
If we wait around, Tina, for government to come up with this, a lot of the money that what goes from to the academics is incredible. That one that Gillian is on has been going for 18 months, and she should actually talk about this. It's academics talking.
like, I get where I'm going with it is, as council, can we not be, or aid in that voice and taking it to Alberta municipalities, putting in a resolution that we want to see hospice funding, not just equipment and staffing, but operational funding to be.
You're talking about the inequity of dying in the hospital and dying in hospice. That's the inequity.
Just to compare, they're doing it there, so we have this facility, why aren't you footing the bill for us over here too?
We also find typically rural versus urban, we don't get the same sort of funding opportunities as the bigger cities do get. And there's a lot of, I'm not familiar necessarily with that hospice, but a lot of questions are, is it a standalone? Is it an AHS funded or an AHS facility? We are unique in that we are the tri-partnership with a nonprofit, and we don't get to access big urban center funding or grants. For instance, that really big $2 million or a couple $1 million grant that was available for palliative end-of-life care last year that we applied for was supposed to only be for rural communities and hospice societies. However, about 50% of the funds ended up going to Calgary and Edmonton for research. To kind of give you an idea of that there is inequality for sure.
Absolutely, and I did look at that as well, and you look at how that 11.3 was divided amongst the 25 projects, and yeah, a lot of it is research or training, support services, things like that. So, but you know, where the direction I would suggest is can we as council attempt to be a bigger voice and work with Alberta municipalities to go
Yes.
forward.
Right there, you've hit
Yeah.
the nail right on the head.
And again, I'm not saying we shouldn't be participating in the funding of it, but I am still on the fence whether it is municipal or a provincial, or even for that matter, a federal problem that needs to be addressed.
And we agree with you.
And if we have to sit around waiting for the next 5 years, we're going to have probably 100 people in this town dying. without the proper facility.
Well, the other problem we have with that too is that the plan that Alberta has is they want, or the government has, is they want to see aging in place. They think everybody should just stay home. Here's your $10,000 to pay for your care at home, but it doesn't necessarily fit everybody's
This is
picture.
where I said about our stage 3, where we can put together a program. This is our dream, okay? Before we start going any plans, we have to have a dream. We have to have a vision of where we want to go. We just can't all of a sudden say, well, we're going to do it tomorrow. We have to think down the road where we're going to go. And we have to think ahead. We've been caught up in the last little while by not thinking ahead because everything was shut right down. Now, when we're talking about the program we asked for with that the program, you know, that grant you had, we had a team of an LPN in healthcare aides who would go in the community and help keep people at home, and they could access that $10,000 at cost rates, not by private companies that are out there now that charge $150 an hour to come in to fold your bed sheets. Okay? We're talking about a low cost, cost-efficient service in the community. So if anybody aging in place, if anybody at the seniors house down here, if they want to die in at the seniors lodge, they will have, at the moment, there really is no free way of doing it for them to stay there in utilizing the area they live in. But so if we had the team that was, you know, could be basically funded through a source, and we could recoup some of our costs through that $10,000, which, by the way, came out 5 years ago and only just been started to be used here this last year. It took 4.5 years to get it going for the first part of those programs. So don't think these things happen overnight and we just wave a magic wand and it happens.
It's government.
We can't, I know, but we can't sit around waiting.
So
you know-
this team, who, in your vision, who is paying the wages for
Well,
this team?
We have to come up with a funding system, and that would be between. There are other ways to, you know, there's other funding systems like Wheatland has. The Wheatland Hospice Society has a seat at the Wheatland Seniors, and the minister approved it, and they can put their own requisitions in for their own tax base on the Seniors Foundation. And my tax, you know, when my taxes are, and I think when we start talking about taxes, let's realise there's the town municipal property tax, and probably half of it is the school tax, and then that little piece at the bottom is seniors funding, seniors foundation. My share is $57 a year. My education one is $990. I don't utilise either one of them, so, but I certainly don't mind paying because as a member of this community, I have to pay for everybody, and that's part of going on in subsidising everybody's way. If we could get that system going for bridge funding, now, but that's of course Seniors Housing Foundation is a different board, isn't it? And they are under a different organisation. They're not under the Municipal Act, are they? They come under the housing. Yes, I actually have I got it all written off in the letter from everything else. So,
And that was one of the things that we actually did discuss at budget was, and I'm sure you saw that on the thing, is there a way we could put this, like, legally onto the tax base so that a small percentage would show up in everyone's
If-
property taxes? But I believe we're not there yet.
No, we have to go. We have to go. If we can unify with the county and everybody get together, and go to the Senior Housing Committee and say, what do you think? We can do this a lot bigger and a lot better.
Yeah.
We don't have to ship, because at the moment, do they have the staff down there at the seniors housing to take care of people when they're in the last stages of life? The answer is no. And if you go to West Family Services, they have healthcare aides, and it costs you for after hours time. Of course, home care will supply the on-care RN, because they're on call for people that are passing away and actually go out to people's homes. Then you have the paramedics who are qualified to go into people's homes to, that's another part of the program we're in, that the paramedics can go into people's homes to provide narcotics, etc. So the system is there, it's just not funded fully. We've, and over the next, God, at the end of 20 years, it's all going to be over because my generation's going to be gone. And so it's going to slow down a little bit. But, we've got this bulge coming through, and if you look at the stats, bring up Stats Canada and see what it is for Rocky Mount Health in the county, and look at that wedge that's coming through for the next 20 years.
I'm going to go to Councillor
Thank you.
Schipholt's question, and then I just had a quick question to kind of go with what Councillor Hutchinson said, and then we'll go to... how many years have you been asking the provincial government for funding for Rocky Mount House?
Well, we started in 2016, and we can only every penny we can get from the Alberta Health Services, they give us. There is no going to Alberta Health Services and saying, we want this money, because they say, this is what you're getting.
Yes, okay.
This is
Thank
what
you.
you're getting.
Thank you.
We will pay for this and we will pay for that. Anything else, that's your problem.
Councillor Schipholt, did you have a follow-up question?
I do.
Okay, thank you.
My question is about your budget that you brought around that I wasn't the last council
Okay.
meeting for. And looking line by line, which is something I like to do, a little over 30% of your budget is for your employee. And I would like to know if that's the norm in that societies, because normally under foundations and societies, the provincial government puts in thresholds that you have to meet and can't exceed for wages in terms of, for your bottom line on your budget. But my real question is this the normal of other functioning societies that provide the same function in other communities? Or is this high, or is this low, or is this the
I
norm?
think we're average. But remember, with the second room, our employee will be a full-time employee. We can't go for a part-time employee the next time around. Jessica now works full-time for half-time wages. And if we paid her by the hour, we wouldn't survive.
Okay, thank you so much. I hope that answered your question.
But Dale, the budget we put forward is the bare bones budget. It's, things like insurance, offices, etc., where we need our for meetings and training spaces, and all our other meetings that are not at the hospital, for our bereavement courses, etc. We need a private space for those kind of functions. And that's part of what we are.
Thank you very much. I'm going to go to Councillor Boniface and then I believe Councillor Phillips.
It's not so much of a question as a statement. One of the things you said was the government took all this money and basically invested it mostly in studies, and it's been my privy that the government would rather study a problem than get off their ass and fix the problem. The other one is, I agree with Councillor Hutchison about asking and doing that. I think that's a great idea, and going in with the county. But to put that in perspective, promises were made to councillors in this room about twinning the highway through Rocky years ago, and they somehow magically forgot that they had ever said that. And I mean, it was only a year ago that they assured us that for sure they were doing it, and then all of a sudden we're not. So they definitely like to change their mind on a moment's notice.
And I totally agree with you on that one. That's why we have to take the bold step and come here. We can't depend on the government. Sorry, we have to depend on local people.
Thank you very much. And so Councillor Phillips.
So I just have one question. Your original ask of $170,000 for both municipalities, that's still the same? That hasn't changed? So
Yes, but
85.
I think if you noted the last time we spoke to you as to how much we're asking from each, was we were hoping you would get along with the county and come to some arrangement, so to speak, because we don't want to come in here. We know that in town here, not everything is 50-50, is it? With the town and the county. We understand that. That's why we've never come here and said we want 50%. You know, if the county, that's where I'd like to keep out of that argument. Let's not out of that discussion, because if there's going to be a partnership between the municipality and the county, is that our business to get involved with what your business is? I know we can stand and make a figure and stand up and make soapbox statements, but I'd rather not come in between that.
So that answers the one question. Just to elaborate on Councillor Hutchinson's comments, and on your comments from earlier, everybody wants social programs, whether it's end-of-life programs or addictions counseling or, name the social program, mental health, we need it all. If you ask people, they want it. Of course they want it. They want the amenities that we have in the Edmontons and Calgarys, which seem to get the money and the rural areas don't. The big question at this table is that going to result into tax increases? That's the decision we have to make, is that we agree every social program needs to happen. How do we fund that as a municipality? That's the big question, is how do we come up with that? That was just a statement, but I just wanted to be clarified on the number of 170,000, that's all.
Yeah,
Thank you.
I understand what you're saying, and it does sound like a lot of money, but remember, we are not asking for anything like capital for bricks and mortar. We have in this town, and very fortunate to have it, Good Samaritans. Not every other town has this. They have for-profit places the same way, and they are in a lot worse position than we are. We're in a position where we can actually be the lighthouse for the whole province as to how to run a hospice.
Thank you so much. I'll go back to Tina Hutchinson in a moment. I wanted to say that, for sure, if you had a letter, I know we've drafted letters with the county before, and if you worked with us, we certainly would support branching out and asking the province or the federal government for more funding. We've worked quite well asking and writing letters for support for our community. And I do know that they have passed this in the county budget for half. And so I think that's to clarify Councillor Phillips' question. And I'm very happy that they did that. We were discussing things at the same time, and it was like ships passing in the night, that, how we did it. So I don't think it's, his question was necessarily like, was it half or how it was? It was just like to clarify the exact amount so that we can move forward with it.
My other question is then, if we can't get anything, can we still get the 20,000? Because quite frankly, that 40 pays for our basics.
Mm-hmm.
And,
Yeah.
we can't go beyond that or go downhill, because we're coming too far. Too many people in this town are realizing what hospice is.
Yeah.
And, every time we have a family go through there that's a big family, yes.
Yeah, yes. I participated with a hospice family just recently, and I have to say it was really impressive that, how the whole program works. If anyone ever has an opportunity, it's just a beautiful way. You could never do that in a hospital room.
Nope.
You could have one person. When I had a friend dying a year ago at Christmas, they had to pick 2 people for the day, period, that could visit that person. And it was between his wife of 25 years, his mother of 50 years, his kids of 22 years and 21 years, that were able to see for that day only. And when you only have a day, it was just more beautiful that at the hospice care, for example, the difference between, the Rocky Hospital bed and the hospice care is that my friend had all 5 daughters and had granddaughters and great grandkids, and they were able to go in and out. And I know that it's important to our community. We are definitely balancing as many things as we can for our community, and
Yeah.
so I do think it's it's a beautiful and valuable service, and I'll just turn it over to Councillor Hutchison has maybe a final question.
Just on the budget, so the present budget with 40,000 between municipal funding, 72,290 was funded from other donations, grants, et cetera, et cetera. So in your future budget, you're asking for 170 for the total amount. What's happening with the approximate 73,000 that you're presently getting through donations and everything else? Wouldn't the municipal funding request be decreased by the 73 that you're already
You know,
utilizing?
by the time we get the second room, if we have to rely on fundraising with our volunteers and have that second room, we can't spread our volunteers around enough to do the proper work they need to do and fundraising at the same time. So that's where that money comes from, because of the extra costs. You know, we do have our fundraiser person in there too. And we, you know, as I say, when we go back in a couple of years' time and we can go back for another SIP grant, and she can be paid for out of that with a budget. But at the moment, financially, we're not that badly off, but we don't want to get low down. We don't want to go down to this point where we can't operate.
So your future ideal picture would be municipally funded operational budget?
Can I also speak to that as well? So the 115, I can't quite see the number, it didn't print very well here, just on the present. So that is inclusive of our hospice suite, our staff wages, office, administration, et cetera, et cetera, et cetera. The reason why there is such a larger number for the future is because we are now doubling that for hospice suite, and also because I will be paid as a full-time employee as well. The other funds, like so for programming or bereavement facilitating, that's not included in this budget. That's all extra that we are currently paying, not within this budget here. This is just what we're paying for operational costs.
I understand that, I appreciate that. I'm just, when I'm looking at the numbers, that presently $112,000 operational budget with only 40,000, so you're getting funds from other places, and now you're requesting just town and county paying 100%
Of our fixed.
of all of those
Yeah.
expenses,
And
just to
then-
clarify.
Yes, and then, so then we would rely on the income that's coming from people who are donating, or businesses that are donating or fundraising for community programs, and bereavement programs and that sort of thing.
If we look down the road, you know, if we could get our own tax base, then that wouldn't be on the municipality, would it? You know, it would be shed from the municipality. So what we're looking for is to get this up and running so it won't falter. And so it won't, as far as being down the road years to come, only municipal and county funding, if we could get the, if, this is a big if, you know, like it's an if coming to the county, it's an if coming to the town. People say, well, why are you going there now? You don't have your second room. But if we don't start something somewhere to get the room and go for the funding, and they come together at the same time, we're in trouble. Maybe they're not going to come together at the same time. So let's look at the future and say see how it can work. You know, if we could get on the seniors housing, and I pay an extra $4 or $5 on my my county tax for the seniors, then we wouldn't be on the municipal budget, would we? If we could move off from the municipal budget, all the better.
I think one of the concerns of the council that
Yeah.
was brought up was that, like, we did $20,000 on the last budget, and now there's an expectation that we do the same amount. So to raise the expectation and then have that, you know, as a weight we have to carry every year, it's a little bit, you know, of a concern.
If that, you
Yeah.
know, if that, if
So-
there is a concern here, now, remember, it's gone through the first level of management at AHS Dale Belcher. Has to go through about 3 more managers yet before it's approved.
Yeah.
Okay?
So in the long
So
run.
how long is that going to take?
Yeah. In the
And
long, in the long run, you do foresee, hopefully, either a seniors housing partnership or something from AHS, the government, to support this program, do you think?
Yes. But, you know, and if we start talking about taxes, we have to we go into town and go to businesses, they're taxpayers anyway, so we're getting a double whammy on the taxpayer. But, you know, the business owner is paying out how much in tax? Plus our donation?
Yeah. So I think, just for time-wise, I think, unless, I don't see any further follow-up questions. I just wanted to say thank you again so much, not only for coming to us, but also for, you know, for supporting this program, starting the program, continuing with the program for our community. It's a really good community service, and I just want to say thank you so much.
I'd just like to add, for all the things I've been involved around Rocky for the last 40 years, this is the one I am most passionate about.
That's excellent. Thank
And
you
I've been
so
involved
much.
in quite a few things.
Okay,
I'm
thank
very
you.
passionate about this.
And I can see why, you know, after visiting the suite this summer, it's easy to see why. So,
I just want to offer.
Oh, yes.
Currently, we are occupied in our suite. Once we do have another discharge, I'd be happy to tour anybody within our beautiful little hospice suite so you guys can see for yourselves. We do have the virtual tour on the website as well, but it does not do us justice, so just to offer that to anybody who is interested.
yeah, that would be great if you sent an email.
Sure.
Probably to Tracy, and then she could circulate it, and then to whoever was free. I know I really appreciated it. When I got elected, there was like a couple days in between clients that you took me, and I, you know, it's just wonderful to see the actual room, so.
Okay.
Thank you.
Thank you very much, folks.
Thank you so much. Would you mind shutting those 2 mics off for us? Thank you so much. I really appreciate it. So moving forward in the agenda, we are going to adopt the previous minutes. So I need a motion to adopt the minutes from September 12th of 2022. Counselor Shippold.
I will so move those minutes as circulated.
Thank you very much. All in favor of that motion? And that's carried. So 5.1 now, because we have a shorter agenda, we're already there. Compassionate Care Hospice Society delegation business. Did we want to discuss this a little bit, or does anyone have a motion that they would like to make, or do we want to accept for information? It's sort of where we're kind of looking at. Is that correct? Yeah.
Sorry, just for clarification, did we not approve the 20,000?
So, Your Worship, to Councillor Phillips, yes, 20,000 for the Hospice Society is in the 2023 budget.
Thank you. Counselor Boniface?
I would certainly like to see us have more discussion on this matter. I definitely support this, and I feel it's something necessary. I realize it's a big ask and everything else, but I'm as passionate as Steve is about it. I think it's incredibly important for this community. And the fact that what they said about Rocky being a leader, there's been a lot of things that have come across our plate in the last year that I think, hey, we should be the leader in this. We shouldn't be waiting for somebody else to come along. We need to be the leader. I don't have any wonderful idea about where we get the money and everything at this time, but I think it's worth discussing and trying to figure it out.
Thank you. Counselor Phillips?
I mean, the passion shows. There's no doubt that they have a passion for this, and there's no doubt we have a need for this. I clearly see the need. The biggest obstacle is, where do we come up with the money? Because it's not just $85,000 this year, it's $85,000 ongoing. We're not sure that we will ever get provincial or federal funding to pay for hospice society programs, so it could be a forever ask. And that's the big question, is where where do we come up for the money for not just this social program, but we're gonna be asked for many other social programs as well, and where do we come up with that money? And I do get it that the public wants that. The public wants homeless shelters, the public wants addiction centers, the public wants mental health centers. But we have to ask our residents, are they willing to pay for that? Because if that's what it boils down to, then that's the big question we have to be prepared to ask the public. Is that something you're willing to have your tax dollars go to? Because that's, in essence, that's where it's gonna come from.
So I wonder if, Mr. Kraus, would there be a way for you to reach out to Wheatland County and talk to them and see how they have set up their seniors billing to be able to support this? Because then it would be like we do for, West, thank you. The building right there. You know, because if that is something that the community would support, and it would be just a small amount, you know, on everyone's taxes, a few dollars or whatever, do you think that would be a good way to approach it, like for the future, like for like next year or something, start working on, or are you familiar with what he was referring to?
So, Your Worship, so it's under the Housing Act is where they can requisition from, and typically it's the operating deficit of a seniors lodge. But it'd be worthwhile researching Wheatland to see how they did it. It would ultimately be up to the Housing Authority if they wanted to proceed down that path.
Okay. So that could be like a future fix to eliminate this funding budget expense if we, in the future, like even say a year from now or 2 years, could bridge that way. Do you think that would be satisfactory enough to, you know, like, I know some of the concerns is once we put $20,000, and it's expected every year that we're gonna put that funding. But if we can, you know, bridge this gap for this year and another year, and then, you know, talk to a housing project or some other model, do you think that would take away your reservations of putting that in the budget this year, Councillor? Like, just to everyone, do you feel that that's, you know, a reasonable approach?
I would think this is also a conversation we would need to have with Clearwater County as well, because right now it's being a 50-50 split. But if you look at the populations, it's 1/3 of the population lives in town and 2/3 live in the county. So is 50-50 an adequate split for programs like this? That would be a conversation we would have to have with our partners, just to see if how that would work, because, you know, it's all tax dollars, and it all boils down to that, and that's what we're talking about right now. I like the program. I like the need. There is a need for it. There's a definite, and as our population ages, which it is, the baby boomers are now getting to that point where, you know, unfortunately some of us are getting to the age where we're passing on. So I like the program. I'm not saying that I don't. I just don't know where the money's going to come from for it. That's all.
Councillor Shiffield?
Councillor Phillips sort of looked at me there when he was talking about aging seniors.
Inadvertently.
Thank you. I guess the concern is that Steve alluded to the provincial government looking at funding the program down the road. And he did say they're looking for bridge financing. So prior to looking at, say, what Wheatland is doing or everyone else, if we're going to look at it, we likely just need to look at bridge financing to get them through, with an annual review likely to see what's happening provincially. If the budget all should be provincially supported, then that would take us right out of the picture. So I think in a discussion that we have, we need to maybe not say that this is long-term for the time being until we figure out what the provincial government's doing and look at it short-term. And then the second part to Councillor Phillips is, do we split that 50-50 or 60-40 or whatever the numbers might be? And that would be a discussion to have with the county for sure. So that'd be where I'm at on that, so.
So, with that being said, you know, we are in negotiations with them. Did you want to have like a formal meeting with both councils to discuss it? Did you want it to go to, ICC? Because, you know, when we look at our goals and visions that we're coming up with together in ICC for the county, senior health and viabilities for seniors, you know, to make Rocky Mountain House a place that seniors, you know, and this option certainly would encourage seniors to A, stay in Rocky, B, move to Rocky, you know, want to retire in Rocky, whatever. Do you want to see it go to ICC and have that discussion, or maybe it's a better question for Mr. Kraus is how do we have that discussion? Like what platform do we use to come up with that?
Your worship, it'd be through the ICC.
Okay, so do you suggest that we go to ICC before we decide on this? Because they've already passed it in their budget.
Yeah, I think regardless whether they passed it or not, I think we need to come up with an understanding as to what goes on. I mean, we passed 20,000. So at this point, I think that, you know, ICC is the answer, and we move forward going that way and see what a formula might look like.
And do it like by population, like percentage?
I think we just open the floor up to discussion and see where it washes at.
Okay.
I think everybody identifies how critical it is to our community. So I think now it's just how do you fund it, so.
Councillor Hutchinson.
I mean, I agree with everybody on the importance of it. I am still stuck on whose shoulders it lies on. And I think that there needs to be a resolution put forward to Alberta municipalities. There needs to be more work done on municipalities' parts to push for, and I feel that it's kind of going in that direction for the government to give one hospice group 2.5 million, which went half of that went to their operational. So if they're recognizing it and funding one nonprofit, it needs to be across the board and it needs to be put down on paper, regardless of how much money we give out. But this is something that's not going away, and it needs to be followed through with bigger numbers, such as Alberta municipalities and rural municipalities on that end as well.
So I certainly agree with you. I certainly think that we should be lobbying the provincial government. One of the things about trail breaking, we're one of the few programs in the province that has this hospice in their community, which makes us completely blessed and very fortunate that they've done all this work. But it also makes it difficult to say every community should have this when we're one of the very few that do. But I think that why couldn't we work with the county and maybe like if we could get a hold of Wheatland County and say, you know, it just takes two communities like we're aware of to bring it to the Alberta municipalities for a resolution and work towards that. It would be a great opportunity to do something, and maybe Steve could give us more ideas of which communities maybe we could approach and partner with. That would be fantastic. So we could certainly make a motion to, you know, write a letter and start lobbying that way. That would be great. Councillor Phillips, I think, and then Councillor Schickel, if I got the lights in the right order.
Yeah, I was going to say that I think maybe we should maybe putting a resolution forth at the next AM convention, lobbying for provincial funding for social programs, particularly in the rural areas. Because they seem to manage to find funds for the Edmontons and the Calgarys and the Red Deers, but when it comes to the rural, which we are, even though we're an urban center, we are still rural, the money never seems to filter and find its way out this far. So I think a resolution at, and I don't know if we would have to make a formal motion for that, and we would have to probably do that at our next council meeting.
Well,
or notice of motion, or I'm not sure how that would even,
So, Your Worship, it'd be a council rise and report that administration draft a resolution to Alberta municipalities regarding funding for hospice centers to the next council meeting. And then we would bring it up.
I would definitely support that,
Yeah.
that rise and report at our next council meeting.
Okay, and so is that a motion that he makes right now?
Then
Did you-
I will definitely make that motion.
Okay. Excellent. That's what I was waiting for. I'm like,
Okay.
it's so close. So I'm just waiting for, is it Tracy or Laura that's typing so fast? A rise and report that administration draft a letter to Alberta municipalities for resolution regarding. Draft a resolution.
Just for information though, Wheatland County did receive part of that 20 million from the government.
Yeah, Wheatland County is, where's Wheat County? They're,
Strathmore.
yeah. It'd be like, Airdrie getting it versus us. Right? They're a huge municipality. February 21st or January 21st?
We would need some time.
Oh, do we, oh, the rise and report would be then. Sorry, I thought we'd have to make that motion at the next meeting. Sorry. Okay, so that looks good to everyone. I'll call that motion to a vote. All in favor of the motion on the screen? And that's carried. Thank you very much. So I'll go to now Councillor Schipholt.
So I think Councillor Hutchinson was touching on this with Steve, and that was about other revenues that they get from donations and whatever else. And really, we never got an answer to that question. They're looking for 100% funding from the two municipalities, taking the onus off of them from going out and looking for those other funds. So
No, but he clarified though, because they're doing a lot of presentations and so then their main source would go for the 2 rooms, and then they wouldn't have to, because they haven't had a fundraiser yet, right? So if the fundraiser doesn't come through, then they can't not pay for the room once they've committed to that, I think is where he was going, because that's kind of what he talked about at the lab. But continue on with where you were going with that.
yeah, and I heard him say that as well. I guess where I'm at is the total 100% need to be supplied by the 2 municipalities, or is there any percentage that can be supplied through fundraising events or donations or whatever? And I'm not sure, I don't think we got the answer. I'm not sure if you did or didn't.
The way I understood from Jessica, that the 72,000, whatever the balance was, would be going towards programming. But from what I have gathered, it seems like the government will provide training for programming, and it's just a different revenue stream that they have to be looking at for it. But I agree, I think it's now putting 100% on the municipalities, and any nonprofit needs to be accountable for operational costs to a certain degree, I believe, I feel.
Okay, so do we need another rise and report to bring it to ICC? Yes, we do. So, I think I'd like to make a motion to do a rise and report, to bring the hospice, I want to use the right words for it, the Compassionate Care Hospice Society, bring it for discussion to ICC. Does that give you enough information to, because then it covers what you were saying earlier. And then, do we want to put, to discuss funding models on there? Yes, I think, to discuss funding models. That's a polite way of saying sharing. And I'm not going to set a timeline on that, or do you want a
So your worship, we could just say the next ICC meeting. I mean, we are looking at trying to establish one late January, early February, just for the airport agreement and rec agreement. So
Okay, awesome. So is there any discussion over that motion, or then all in favor of that? And that's carried. So I think that sort of brings us to a close. Do we want to accept for information, or does that enough to continue on in the agenda? Do we have to do an accept for information for the delegation now that we've got the two motions or rise and reports? Okay, so then we'll continue forward in the agenda and go to 6.1, old business curbside recycling blue carts. Mr. Kraus, if you
Yeah,
want to
no,
start, I just
yeah.
lost my computer here.
No, thank you, your worship. So at the last council meeting, council received a delegation from the RCA in regards to the EPR. In that presentation, it was a suggestion or recommendation from the delegate, the town not make any major moves or investments until it's more clear how the EPR is going to roll out. As council is aware that council did approve the blue recycling bins in the 2023 budget, and the administration actually is in the process of a survey for bin size, or not a survey, but an engagement process for size of bins with citizens. So council has asked it to come to the committee of the whole for more discussion amongst council whether to proceed with the blue bins or not. In the RFD, we provided, probably 5 notes for considerations for council to discuss to help council make that decision.
I'm just trying to get to the right page. So, do we want to discuss all the nodes, or does anyone want to start with a statement? I can read them. The public have requested the carts for their convenience. We think that more recycling might happen if it's more convenient. I don't know if the costs of the cart, can they be justified if they only service for 2 years because of whatever's happening? Does anybody want to? And then 4, the town may have to dispose of the carts in 2 years if things change that we can't use them, or it's a different service provider. It's total unknown, so it's not like we will have to or we won't have to. We don't even know what's going to happen. And then if the town maintains service delivery, the service will be already established with carts in place. So then if they're going to maintain the service that we're already giving, and we have the carts, then the province has to continue giving the services, sort of like what she said, but we don't know about the carts, kind of thing. Does that sound like a summary of the 5 points there? So I certainly was keen to not spend money if we didn't have to, but I totally understand that people certainly had, some concerns that'd be easier with carts than without. But I don't know, be $70,000 a year if we didn't utilize them for the life of a cart's, 20 years? 10 years? 10 to 15 years, so it would be I'm sorry, Councillor Phillips, I was waiting for another light and then yours went on.
So I wish we knew what the EPR was going to look like. Right now, we're speculating what is going to come down the pipeline for EPR, but we really don't know, which makes it really tough to guess what's going to happen in April of 2025 when it's implemented. We have already, made the statement to the public that they are getting the blue bins. If we take that away, I have a feeling that will not be received well from the public. And I do believe that our uptake will be better having a bin service as opposed to a depot or whatever type of service. So I just wish we had more information about EPR. We need to move forward in what we're doing, but without knowing what EPR is going to eventually come out with, it's kind of a tough, it's tough projecting what's going to happen in 2 years.
So thank you so much. I agree. I do think that if we, explained it to citizens that we're trying to save money because we don't want to waste it. I mean, that's what, in effect, what we're doing. I don't think they would be angry for us not spending money, but you're right. If they're anticipating getting a bin and then we take that away, there's just been so many changes. So I agree with you on that. Councillor Auld.
Yeah, I agree with Councillor Phillips. This has been a path we've been going down for the last couple of years, and this was the kind of the communities coming together with this program. As we just discussed in this last topic, we have no idea what the government's going to do, when they're going to do it, how they're going to roll things out. And I think we're on a pretty strong path to move this program ahead. If the concern is about the bins and the price tag for the bins, I just can't see if the Pro comes in that these carts would be not usable. There's so many municipalities in Alberta that are using the same bins. It's the same stuff everywhere you go. I would be strongly in favor of just moving ahead with the program. We're rolling the carts out as we're planning.
Thank you. Councillor Boniface.
One of the comments that was made by the delegation was that there might be the possibility that we could rent. And I just didn't know if that had been, I didn't know that was ever an option, but if it was an option that we could get, we can't. So that answered that question. So I agree with the councillors that we've gone down this path, and although I would like not to spend the money, 2 years for the government to make up their mind what they're going to do with something is a long time. And I'm hopeful that if we went with these blue bins, I mean, the recycling's not going to change that great. So basically, everyone has the choice to have either a big bin or a smaller bin, but you're still going to have a bin. So if there's a new collection agency picking this all up, they're still going to have a bin. So, at that time, maybe we could make a deal where, okay, it's going to cost us this much money, but hey, we've already got our own bins. We do not need to purchase your bins, or you purchase our bins back from us, or whatever.
Yeah. And so, Rob, I just want to clarify that they're not available to rent like she suggested.
They're not.
Yeah, thank you. I just wasn't sure if we not looked into it or it's not possible. So thank you so much for clarifying for me. I really appreciate that. I agree. My concern with the larger bins is that, is it something that any vehicle would be able, because I know that Red Deer bins, when you drive around Red Deer, they're the same size. So back to my concern about the size of bins, if we go forward, should we get the same size that we already have? Is the bigger bin going to be an obstacle in the future for a different provider? Would we have any information on that?
Speaking with Rio, no, the provider now. The trucks, the clamps are able to pick up any size.
Okay. Oh, he doesn't have a mic. So that's okay. So no, Rio, the current provider would be able to, just for the TV viewer, the current provider would be able to use either size of bin. But the way she discussed is that current provider might not exist in the future. She just put a lot of unknowns in the future. And so thank you for your information. Councillor Auld?
Just back to Councillor Boniface's comment, it will be up to us to negotiate with the Pro when it comes in. We have the bins, you don't have to buy them, it's a rebate back, or however it works out. And we don't have to use their program if what we're doing is working. Everybody can use the same, we can use the same system and be rebated back, or it's all, like I said, it's too unknown to leave sitting on the table for 2, 3, 4 years.
I totally agree.
Counselor Hutchinson?
I feel that we should keep go forward with the blue cards. Where I have concerns is the EPR as it sits right now. Cans are not included in recycling. And if that change comes in 2025 and the pro that's picking up, because we're used to putting cans in our recycling and they don't, that's their headache, not ours, because people have established those habits already. So until they put some more definitions underneath that category of recycling. But I say just do continue on the way we're going with the Blue Bin program.
Okay. I had someone ask me, just for administration, have we been telling people that they're not allowed to do the survey or that they can't access the survey because we're discussing it right now? I got feedback from someone saying that they called in and had an issue. No. So the survey is still open, and if they phone the town office because they don't have online access, they can deal with it that way?
It's open until, I believe, the 27th or whatever the last Friday in January is. We have between 150 and 200 requests for the more modest size bin, but there are some duplicates in there, I noticed when I came back from holidays today.
Okay.
But no,
Okay.
there's
so
been no change.
Okay, so that survey is still good to go. So, would someone, do we have more discussion? Did someone want to make one of the, motions, then to proceed? Counselor Ald?
I'll make the motion that be it resolved, the council accepts the blue cart report for information. The meaning administration would proceed with purchasing the carts for this resolution.
Yeah, I think so too. I really like the idea of not spending money, but I'm in agreement. We should move forward, so, thank you very much. Any other comments on that motion? Seeing none, I'll call that to a vote. All in favor of, or do you want me to wait for the typing? Okay, all in favor of that motion? And that's carried. Thank you very much. So, new business, there's 7.1 an RFD offer to purchase 4503 and 4511 42nd Street. Mr. Schrader.
Good evening, Mayor Bache and Council. We did receive an offer to purchase for town-owned building on 42nd Street, 4503 and 4511. I'll refer to it as the old rec building. We purchased it in 2006 for the use for the Parks Department and the Rec Department. Since then, we've leased it out. We've put it on the market in 2019. It did get appraised for $690,000 in 2019 by Colliers, and then it was assessed in 2021 for $789,000. That assessment was, say, December 31st, and at that time it was being leased by Saskatchewan Friendship Center, so it might have raised the actual assessment of the value of the building at that time. The offer that we've received for purchase is $700,000, which is a fair market value for the building in question. And so there is some recommendations that I've, alternatives and recommendation for the property. Is there any questions in regards to the property in the report?
So the Colliers is a traditional evaluation of the property, like for sale, like
Yeah,
you know,
appraisal
like
company that would come in.
Yeah,
Yeah.
and so the assessment is what the tax. It's like the tax assessment. It's not a full 360 appraisal,
Correct.
right?
That would be what our town assessor would do.
Yeah.
Accurate assessments would do it in 2021, which I think we contracted them in the fall of 2020.
So did they do an actual hard copy appraisal that you take to the bank, or just, sorry, there's two different things,
Yeah,
right?
there's an appraisal and assessment. They just did an assessment on the
Right, so
property.
they haven't done like the full
No.
360
No.
that you would give to the bank.
Right.
So that first number would be sort of more like the bank would.
Accurate.
Yeah.
Yeah,
okay.
accurate.
That's
Yeah.
where I was going.
And granted, it is a 3-year-old appraisal as well, but there hasn't been a whole lot of change in the market within the town of Rocky Mountain House in regards to industrial buildings and lots over the last 3 years either.
Yeah, I just want to clarify our numbers because really that's why it's come to council, because if it was for the assessed value, then it would be done already. It's because it's in between the assessed and appraised, right?
Correct.
Is that, am I just clarifying?
Yeah,
that
Your
for
Worship,
myself?
you're correct. So
Yeah.
really what administration is trying to, establish tonight is council's comfortable that the offer is at market value. Because if it's at market value and council's comfortable with market value, with it being at market value, then the administration can just proceed with the sale as per policy. If council feels it's below market value and still wants to sell it for that price, well, then there's some requirements in the MGA that we would have to do because you're selling it below market value. But administration is pretty confident that the offer is at market value using the 2019 appraisal and the changes in the market in the time.
Let's see, I don't know who was first. I saw Counselor, sorry. I will go with Counselor Phillips. I did see Counselor Walls, but you always have a question.
No, I just more of a comment, regarding the 2019 appraisal. I believe would probably be more accurate simply because the tax assessment would have used the rental approach for some of this value. And for commercial properties, is a direct cost of building minus depreciation to figure it out. The value of a building, the rental income will also determine a value of a building. When a building is empty, it is not worth as much from an appraisal point of view. So I believe the 2019 appraisal is a more realistic number.
Thank you. Counselor Ald.
Well, Counselor Phillips said exactly what I was gonna say, and I am 100% with going with the actual appraisal.
Counselor Shiphold.
Uh,
And then Counselor Boniface.
I just want to know what conditions are on the sale, if there's anything that's,
They were listed on page 3 there. So as far as what's listed here is what's being requested. So kind of the biggest thing is probably the environmental study, as well as also the building inspection. It's operating presently, but when someone comes in to do an inspection, they may find something that we're not aware of or a red flag that may bring attention to the purchaser.
I knew I read them, but I can't locate them. Oh,
Oh,
thank you.
they're on page 4. Sorry, Councillor Schipel. They're been.
Have we done a phase 1 environmental site assessment
No,
before?
and I think we're at the first stage right now as far as agreeing on the price, and then we'll proceed from there.
Yep. Counselor Boniface, sorry.
I support what Counselor Phillips and Counselor Alt said about the selling price. I feel this building's been a bit of an albatross for us, and be good to see it in the rearview mirror.
I'll go to Counselor Hutchinson.
I agree, and I'm ready to put forward a resolution.
Yeah, go ahead.
So be it resolved that the town of Rocky Mountain House accept the offer to purchase price of $700,000 for 4503 and 4511 42nd Street, Plan 8122535, Block 64, Lots 4 and 5, including all conditions included in the purchase contract.
Just before I put that to a vote, does anybody else have any follow-up questions? We're all comfortable with that? Counselor Ald?
I do have a follow-up. Is it, I can't remember, is it standard procedure for the seller to do this study, or is it usually the purchaser that does the study? Or is it?
It's usually the seller that usually will do it if they're keen on selling the property.
Counselor Phillips, sorry.
Sorry,
I
just
wasn't sure
the-
that was it.
Those conditions are very standard that are on that offer, so.
Yeah. All those things you need for the bank to give you the money. Pretty much, right? So, I'm not gonna sell it unless you do those things anyways, unless someone has that much money, so. I'll now call that to a vote. All in favor of the motion? Do we have to do the rise and report? I'm sorry.
No, Your Worship. So basically, council just established that they're comfortable with 700,000 as a market value, so now we can just proceed as per policy.
Thank you, because I know it's, sorry. I'll just see a show of hands again. All in favor of that motion? And that's carried. Thank you very much. Thank you, Mr. Schrader. Okay, so moving forward to 7.2, RFD for McNutt subdivision assessment subclass. Is that Mr. Kraus then?
Yep. Thank you, Your Worship. So council requested that administration draft a report on the McNutt subdivision and see if it warrants a subclass for taxation. Administration has drafted that report. I don't know if council wants me to go through the report in its entirety, or if council just wants to ask questions or comments, or I'm fine either way.
Does anybody have any questions or comments? I'm trying to find it here on my. Counselor Shippold.
Possibly, Mr. Kraus, you can just give us the Reader's Digest version of this. And
Sure, thank you. So, in the report, we start out and just, just to keep as a reminder that property tax or a business tax has no direct relation to the services are used by the ratepayer, right? Property tax is not a fee for service, but a way of distributing the cost for services and programs that council determines necessary or desirable as the community as a whole. Just using that as the basis. And property taxes and ad valorem tax, it is based on the value of the property, which in turn provides principles of what is considered a good or fair tax. So the pertinent tax principles to this analysis in regards, there's a few more, but to this particular one is neutrality. So property taxes should not influence economic behavior for such decisions where people live or establish a business. The same tax rate throughout the town for each assessment class establishes this. And it's vertical equity. This is the ability to pay. A person with a higher value property should have the ability to pay more in taxes than a person who buys a home with a lower assessed value. Then there's horizontal equity, where homeowners are the same in all relevant aspects and should be treated the same. Basically, a house with a value of $250,000 would be taxed the same rate, whether it was in Riverview, Old Town, Creekside, or McNutt. Then there's also the benefit principle. So homeowners who benefit more from town services should pay more in taxes that support those services. But you would have to really identify what that benefit is to warrant a different tax rate. And an example would be if we had a transit system that went throughout town but did not go to McNutt, well, then it would not be fair to tax McNutt for the deficit of a transit system, for example. So it is through this benefit principle that some residents living in McNutt have raised a concern about property taxes. So the examples given by council during the discussion were water and sewer, sidewalks, fire hydrants, with a comparison of properties along 60th Street. So these items I'll discuss below with a comparison of assessment. Primary land value as the house assessment varies both ways between McNutt and 60th, depending on size, age, and condition. So in regards to water and sewer services, well, these services are fully funded through utility billing, so no tax dollars are used for the services. This includes repairing water main breaks, repairing the road where the break occurs, so no property taxes generated from the McNutt subdivision or anywhere else in town goes towards the operation or maintenance of this system. Water and sewer do have an effect on land value, which in turn affects assessment and property tax. Service land has a higher value than unserviced land. This can be seen in comparing the assessed value of lots in McNutt to 60th Street. So, for example, the average lot in McNutt is 2 acres with an assessed land value of $148,000. The lots along 60th Street are smaller. The closest lot size is 1.7 acres, which has an assessed value of $411,000. The average lot on 60th is 0.6 acres and has an assessed value of $212,000. And then they could go to Creekside, for example, with 0.16 acres. The average land value is $110,000. So while other factors go into land value, like paved roads, sidewalks, location, etc., the land value in McNutt would increase if they were serviced with water and sewer. Even though water and sewer are not funded by taxes, the assessed land value in McNutt would go up. This would result in the residents paying more taxes, so they pay less taxes because of the infrastructure improvements, which aren't there, which is fair. And I apologize if I'm slurring a bit because I had a tooth pulled yesterday, so I'm trying to struggle through it. So.
You sounded just great.
Thanks. So regarding no sidewalks or asphalt road, the same principle discussed above would apply. So the land value would be higher, and as a result, more taxes would be paid by the citizens of McNutt. The maintenance of sidewalks and roads is supported by tax dollars. So does the McNutt subdivision receive a significant lower benefit in maintenance because of a different road type and no sidewalks to warrant a lower mill rate? The answer is no. So McNutt and Old Town have a SB 90 dust suppression road structure versus an asphalt road structure that is the majority of the town. Both types of road receive the same service in snow removal, sanding, sweeping, pothole repair, and stormwater management. Our asphalt roads require crack sealing, and this is done approximately 50 kilometers of road with an annual budget of $48,000. The SB 90 treatment is fully applied every 3 years in sections for a cost of $30,000, then budgeted for $15,000 in maintenance in the other years. And this is for approximately 5 kilometers of roads in town. So in consideration of this, the properties in McNutt receive 3 to 5 times higher level of road maintenance dollar-wise annually than a resident with a paved road. So in that aspect, they actually receive a higher level of maintenance, even though it's not as nice a road, I guess. Maintenance benefit can also be looked at another way. So the average street frontage for a house in McNutt is 61 meters. On 60th Street, the average lot frontage is 23 meters. So a lot in McNutt receives almost 3 times the road maintenance and snow removal than a lot on 60th Street. In comparison, the town receives approximately $4,000 in tax revenue from one lot in McNutt to the $12,000 received from the 3 lots on 60th with the same amount of frontage. So density is obviously a key factor in both taxation and maintenance per lot. So from the analysis of the previous paragraphs, it can be concluded that the road maintenance, the McNutt subdivision costs more per lot to maintain, and this cost is subsidized from tax dollars from higher density residential and commercial development. So the final point was made was no fire hydrants in the subdivision, which results in higher home insurance. This is true, and it's a choice a person makes when building or purchasing a home. It is a decision of wanting to live in a country residential setting, knowing that the same service standards do not exist in a denser urban neighborhood. The lack of hydrants also places a burden on the municipality in that the fire service still needs to respond and equip itself with tenders and contract private water haulers to ensure adequate water supply to fight a fire. So it kind of works a bit both ways there. So to summarize, the residents of McNutt receive the same level of service for parks, recreation, library, policing, fire, culture, economic development, and governance as the rest of the town. The area has a different road structure, but it receives the same maintenance level. The area does not have water and sewer, but this system is cost recovered with no tax dollars supporting it. With land values a third of the comparable on 60th Street, they pay lower taxes but benefit from higher road maintenance. So, in summary, council may create a residential subclass to establish a lower mill rate. Old Town would need to be considered in this, as is the same road structure and no sidewalks. Council would need to justify this, but the reason is not apparent. there may be stronger argument to have a subclass and have a higher mill rate to compensate the inequities in road maintenance costs. However, the amount is insignificant considering the budget as a whole, and the additional administrative time and public perception of this would not make it worth it.
Thank you so much. I think that's a very detailed report. And I want to say that, in a nutshell, the McNutt subdivision is being taxed fairly. Because I just wanted to use in a nutshell. Councillor Shippold.
Thank you, Your Worship. I do agree that the report basically points that direction. I'm somewhat think it's a bit biased in terms of its reporting. That area doesn't have fire protection, so to speak, in terms of fire hydrants and curb and gutter and street lights and sidewalks and road type, and there are definite differences between that. And unfortunately, I did use 60th Street as an example, and I should have probably used 58th Street, where, comparing residential to residential, because 60th Street pricing is definitely more because of the location and the viewing. So my bad on that one, and but I still maintain that it's easier to be fair than to take the easy route. And I think here to be fair, and if there's, homes in Old Town that are equivalent in terms of what we supply, I think the council needs to be fair to all of its citizens. And unfortunately, the McNutt subdivision, yes, the lots are big, but I think if you talk to most landowners out there, it's probably like an albatross to them. If they had their option, they definitely wouldn't have that big of a piece of land. But in the day, because they have their own sewer and water systems, AHS, the minimum lot size was 2 acres for that to occur back in the day. So it wasn't it was a requirement by government means to do that. So anyway, I'm still in favor of looking at a subclass to be fair to the citizens of the community, that we do not offer the same stuff we offer on, say, 58th Street or any other street in Rocky Mountain House. That's got a curb and a gutter and in some cases, stormwater system, sidewalks, all that kind of stuff. So I read the report, but I'm still thinking that the residents that don't get the services need to have a subclass. It doesn't have to be a big difference, but just something.
Thank you. Councillor Auld, is that right? Yeah.
I understand where Councillor Shippold's coming from for sure. But I look at it a little differently. Everybody has a choice as to where they're going to purchase a house, or where they're going to live, what they want to have to look out their front window, whether they want to look at another house or if they want to look at a beautiful landscape yard and have the space to function. It's their choice to live out there, and they've accepted the services that are out there. I think this report definitely shows there is some inequity and possibly the other way. It's at the end of the day, it's residents' choice where they want to build their house, where they want to live, and they go into it knowing what the services are and what the taxes are. So I'm pretty comfortable with it the way it is.
I'm sort of on the fence. No one else has a comment. I'm sort of on the fence. I agree that it's a different class than a normal residential subdivision, but the town limits has to draw a limit somewhere. And one of the advantages is that they're in the town limits. But that's also an advantage because they're 1 kilometer, not 20 kilometers from everything. So I don't see why we couldn't look at a subclass. But in the end of the day, would it make that much of a difference for those citizens specifically, do you think? And then, Councillor Phillips.
Just looking at taxation is equated to the value of the land or the value of the building on that land. If McNutt or Old Town had sidewalks and paved roads, the value of that property is going to increase. It's going to increase slightly, but it is going to increase, which will increase the overall taxes. So by not having sidewalk and not having asphalt roads, the value is a little less, which means the taxation is a little less. Have they had those, the taxation would be a little more. So I'm fine with this report as presented and the explanation of it. I don't see the need to have a separate subclass.
Any, Councillor Hutchinson?
Yeah, I agree with Councillor Phillips. I also don't think that opening a can of worms with subclasses on properties is a direction that I would like to go, but I'm in favor of just receiving this report as information.
Councillor Boniface?
Councillor Shipple made the point that it didn't have to be a lot, it could be just a small amount. Did you have a percentage in mind?
I did not have a percentage in mind, and I thought that we could give that back to Mr. Kraus to have a look at if we determined to do a subclass. We have several subclasses in Rocky already, in every category. And so, I mean, we've already went into the deep water with subclasses, you know, vacant lots, big business versus small business, all that kind of stuff. And so we as a council have looked at that already and have set precedents that we do have subclasses. And I think the people in McNutt have been sort of grinding at this for a while. I think if you talk to any of them, they got a bit of a bee in their bonnet thinking that they don't get what other people get. And granted, Councillor Phillips, I mean, yes, if you do improvements, there is increases in taxes, and I think they understand that and know that. But they don't have those, and those who are paying $8,000 for taxes on their house, their question is, how does that compare to somebody in town, and what kind of house do you have in town? And they typically have to go into, you know, substantial developments to pay that. And talking with a couple of the landowners out there, one pays $7,400 a year, and his concern is when he talks to people in town that have houses, they're, you know, houses like he has are paying $5,000 a year. So, you know, he said it's his land size more than anything that drives that, unfortunately, and nothing he can do about that. But I think that if we did any kind of a acknowledgement of those people in McNutt and the people in Old Town, and again, I revert back to doing what's right, not what's easiest. If we show respect to our people, then they're gonna, you know, say, hey, we take care of them, and it doesn't have to be a big difference, it just needs to be acknowledged. And so I would advocate that we should look at a subclass and go that route.
Thank you very much. I think, you know, I agree we should be fair. And I agree with Councillor Shippold. Councillor Auld, I think, was before Councillor Phillips this time.
I'm just curious, when we look at the assessed land value, average lot in McNutt is 2 acres, so instead of 148,000. So then the difference has to be in the actual housing out there and where it's at, where the houses are located. If the lots are being assessed at half the price of the lots in town. So is that even a fair assessment just on the property?
So I'd certainly like to know what a county lot would be assessed at for land value. So if we're gonna compare apples to apples, I know they're outside, but you could have someone across the fence that has their land assessed differently. You know, it's hard to compare a house in Creekside to, like, if that's what you're referring to.
No, I was asking administration if it's possible that those lots are actually under assessed for administration.
I would have to consult with our assessor on that.
Councillor Phillips.
Yes, my concern is based on what I'm reading in this report. If we look at creating a separate sub-tax space or culture or whatever you want to do for McNutt, that they may actually pay more in taxes. That, reading this report, it almost looks like that may be an issue where it may be higher taxation. I don't know. I mean, I wouldn't want to say that for sure, but based on this, it may look like that.
Well, one of the things in the report, and I referred to this earlier, where I used 60th Street as an example and I asked a question. And so maybe we're not comparing apples to oranges, or apples to apples, but apples to oranges. And I, you know, I just think something, just acknowledge what's going on there. Subclasses is not uncommon. And so to go to that in this situation, and others say in Old Town, I think it's fair. And I think we need to be fair, and by not taking that, then I don't think we're being fair to the people there. They've definitely voiced their opinion many a time, and I'm sure if you've had the opportunity to talk to any of them, that's, you know, and they know you're a counselor, they're going to bring it up how they feel about that. And they compare themselves to, you know, other places in town, and they pay hefty tax bills out there, and they're saying, hey, we just don't get what the others get. So that's the way they feel. And
I like the idea of a subclass because if you look at the expansion of Rocky Mountain House, we might arbitrarily, without meaning to, gain similar properties in the future. You know, we are looking towards developing and growing and all those things that eventually, you know, we might move our boundaries and have to amalgamate or take over similar properties, which is, I think, originally kind of what happened anyways, was that the boundary was on one side and then the town expanded, you know, to make clear lines. So I think the idea of a subclass, because we've already got a couple other ones, would be good. Did anybody want to make a motion? Councillor Phillips? Or sorry, who are you over there? Councillor Shipples.
Okay, I'll
And
make
then
them. I will make the motion that let it be resolved the council instruct administration to draft a bylaw that creates a residential subclass for areas without asphalt roads, sidewalks,
Okay,
and what other services may be.
Councillor Hutchinson, did you want to comment?
Well, I was just going to comment before that was put forward. Maybe an administrative inquiry instead of going to the step of a bylaw already, and an inquiry to give us kind of a outline of what that would look like before we went to the step of a bylaw, if that's a possibility.
It's going to be this. Go ahead, Councillor Shipples.
We can go that route. I have no problem with that, and I would gladly remove my motion and move to,
How about just a friendly amendment?
or make a friendly amendment to my motion. And that's to change it from creating a bylaw to bringing information forward relative to that, and what a bylaw would possibly look like.
Is that possible?
Yep.
And then I'm waiting for her to finish typing.
Councillor Shippel, does this capture it?
Can you put to bring to the next committee of the whole? Or a committee of the whole? What would, the next one is already full, do you want to just add a committee of the whole? Okay. Thank you for doing that, and we'll go to Councillor All before.
Just to discuss this, I still go back to the fact that people move to an area that they want to live in. So if they want that atmosphere living out in McNutt, that's what they've chose to do. That's where they want to live. If the guys want to live on 60th Street, they know what the taxes are. They know what they're going to get. It's higher than anywhere else in town. they make the choice to live there for the benefits that they have. I just don't see how giving a lower tax rate to one group, I just don't understand that. I'm not willing to go down that road.
I see Councillor Phillips has a,
Just a comment. I mean, to me, assessed value is assessed value. If there's going to be sidewalks and paved roads, it's going to be a different assessed value, which will increase taxes. So, to me, I think whatever your assessed value is, that's what your taxation's based on. So I don't believe we need a separate subclass.
I still like the idea, if we grow the town, we're gonna get more of these little properties, or that we're making it fair, so. I don't see any further, questions or comments, so I will call that to a vote. All in favor of that motion? And all opposed? Is that tied? Yep, so, cause it's tied. Sorry, I didn't have Marley here, so then I was like. All right, so, would you like to anyone like to make a different motion? Or do you want me to discuss it some more? Counselor Auld.
I'll make the motion that council accept the McNutt subdivision report for information.
Thank you very much. All in favor of that motion? I'm gonna carry it. And all opposed? And that's carried. So that we can move on with the meeting. So, do we have any correspondence for action? Do we have any correspondence for information? None. The action list. Mr. Kraus, did you want to
Yeah, no, thank
make
you.
any comments?
Thank you, Your Worship. It's actually all completed, I believe. I looked. No, so the municipal incentive review, that's in progress. That will be coming to, I believe, the next committee of the whole meeting. That's the development incentives. And then the only one else that isn't crossed off is the website redesign in fall of 2020, which should be crossed off because that is complete.
Okay. Do we have any questions for the action list? Seeing none, I'll make a motion to accept for information the action list as presented for January 10th, 2023. All in favor of that motion? And that's carried. Do we have any administrative inquiries this evening? Councillor Boniface.
Yes, I had brought up that during the policing committee meeting that we had discussed with the town officer about shoveling the sidewalks and the amount of effort and time they put in to issue a $75 fine. And I just feel that if we're going to do this, we either make it high enough and give it some teeth so it actually does something, or we're wasting a good officer's time because she told us all the steps she has to go through, and there's a lot of hours in there that she spends to make $75, and it just does not seem worth it. We're wasting our valuable resource there as far as I'm concerned.
So, Your Worship, to answer Councillor Boniface's question, that report is being drafted right now to bring back. I'll look at.
Yeah, we're not sure like whether we'll have it for the 17th, if not, it'll be for the 7th of February. That's fine. Yeah, whatever you're all set.
Did I see another light? Nope. Yes. Councillor Hutchinson.
I just wanted to speak on this meeting. So it's a committee of the whole meeting. We are proceeding ahead as a normal council meeting. Like some of the things that are in the bylaw, have we changed our procedural bylaw to fit what we're doing? I mean, for example, the only motions permitted are to put forward to a council meeting. We're able to speak kind of more casually out of, I just feel that being in camera has lost the informal and the open discussion that we have had in the past at committee of the whole meetings. So I'm kind of inquiring if, like I said, has the procedural bylaw been changed, or?
Can I just clarify, are you asking if we're running the meeting right? Because it seems different?
No, I'm not asking if I'm running the meeting right. I'm just saying, to me, it feels like it is as same as a regular council meeting.
It
And
is.
my understanding was, under our procedural bylaw, a committee of the whole meeting is different than a regular council meeting. So it's just not clear to me.
Can I turn that to Mr. Kraus to clarify?
Yeah, no, sure, Your Worship. So at the committee of the whole meetings, there is the opportunity for a lot more discussion, because the items that we're bringing forward or that council's considering at committee of the whole are basically discussion items the majority of the time. So, and council doesn't make a formal decision at a committee of the whole meeting, but they still pass resolutions. And those resolutions will be either just to accept the report, bring back more information to another committee of the whole meeting, or if council's discussed an item that they feel they're ready to make a decision on, then it's a rise and report, so council can make the formal decision at a council meeting. But the discussion, yes, is typically more fluid and wide open, so.
I guess
Councillor Hutchinson.
if I may comment, I think, yes, we need to be accountable and transparent to our taxpayers, but I also think that these meetings could be a better opportunity for us as council to have better discussions than when we're out of camera than when we're in camera.
Okay.
So that's just kind of where I sit with that.
Okay, so thank you for your comments. Is there any other administrative inquiries? Do we have any notices of motion this evening? I don't see any closed session items, and so I think our business is concluded, so I'm going to adjourn the meeting this evening. Thank you very much. Meeting adjourned.